Hey everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Knee to Know Show, we're going to go over heel slides, a really important exercise for improving your bend or knee flexion after knee replacement surgery. So today we're going over heel slides, and this is a really common exercise before or after surgery for improving your knee flexion or knee bending. So what you're going to need is some sort of strap. So I have a stretching strap here. You can also use a belt, a dog leash. You can use a towel or bed sheet rolled up. Anything like that will work just as well. And then you're going to need a flat surface. So a bed, a couch, whatever that may be that you can lay down flat in. And then the last thing is you're going to have the ability for your heel to slide on that surface. So usually just wearing your socks can work effectively. If that seems to be difficult and still having some trouble with sliding, another thing I could recommend is taking a grocery bag, putting it over your foot and just tying a little knot in it. And usually that plastic grocery bag tends to slide very well too. So what you're going to do is you're going to lay down flat, and you're going to put the strap right around the ball of your foot and hold on to it with your arms. Now all you're going to do for a heel slide is you're going to slide your heel like the name says, and as you do you're going to be bending your knee and bringing your heel toward your bottom. And so what's going to happen is eventually you're going to get to this sticking point where you feel stiff, tight, pain, and you can't bend the knee any further. When you get to that point, all you have to do is apply a moderate intensity pull. Doesn't have to be significant, doesn't have to be a 10 out of 10 pull, but a moderate intensity just to give a little extra bend, a little extra pull into that flexion position. You're going to hold that for maybe 10 seconds or so, and then slowly let the leg come back down to the start. Now, something that can be very important with this is sometimes people will try to do this exercise right away, kind of cold, first thing they try to do. And that's going to cause a lot of pain and discomfort. Now, one way to help kind of decrease some of that pain, some of that stiffness, and improve your ability to tolerate doing this exercise is a different strategy to start. And what I mean by that is instead of doing that max amount of bend, instead we're going to do just some very gentle repetitions, a little bit smoother, a little bit more continuous. So you see I'm not bending the knee all the way up as far as I possibly can. I'm just doing a little bit of bend and then going back to the starting position. Maybe doing 10, 15 repetitions at a time. Then after you do that for a few minutes or so, hopefully you started to get some blood flow to the area, things start to loosen up, a little bit fluid to the area, and you're able to then tolerate that max bending type of motion a little bit more. So again, coming up to that max amount of bend that you possibly can and holding at that end range of motion. People always ask me two big questions with this. The first one, should this be painful? Well, unfortunately, you've had a major knee replacement surgery, it probably is going to be painful and uncomfortable to do this exercise, especially early on after surgery. Now, should you be cranking on the knee, and is this a no pain, no gain type of situation? No, I wouldn't say that. I think we want to focus on a moderate intensity and focus more so on just getting a lot of repetitions and a lot of time with that knee in that bent position. So you don't have to go at a 10 out of 10 max intensity, but there is still going to be some pain and discomfort that you have to work through a little bit. Now the other question is, how many sets, how many repetitions, how frequently should I do it? Well, there's nothing necessarily written in stone. What I would recommend early on is trying to do this exercise and your other range of motion exercises maybe 2 or 3 times per day. And what I would always recommend is start with 1 or 2 sets of just those short back and forth repetitions. So 1 or 2 sets of just those short repetitions to warm up the knee, and then after that do 1 or 2 sets of the holds. So usually what I'll recommend is doing 10 times, holding each time for 10 seconds, and then slowly going back to the starting position and doing maybe 1 to 2 repetitions of that at a time. So again, that's not written in stone, but just a general recommendation. This has been Heel Slides. Please leave a like if you got some useful information from this video. Please leave your comments and questions below. I try to respond to every one I get. And as always, be sure to subscribe if you don't already. If you found this useful, we share all videos about knee replacement surgery, exercises, frequently asked questions, details of the surgery itself, and everything in between. Thank you very much for watching.